didn't ask my husband. I kind of signed up, and then 48 hours later got a phone call saying like, hey, can you be on a plane in 24 hours? And so I kind of turned to him and said, hey, so I know we have a 3-year-old and a 5-year-old, and I know there's like this massive global pandemic happening, and I want to go to the epicenter. Is that okay? And oh, by the way, I'm leaving in 24 hours. I can honestly say this is the least crowded I've ever seen Denver International Airport. Hi, Camille Sasson. I'm an ER doctor. I have been practicing now for 18 plus years. Work here throughout the Denver metro area. You know, I think within just a few weeks, the numbers started to spike in New York City. It was clear to me that I needed to be out there to help. I wanted to know what this new disease was, right? So the part of this is, you know, it's a completely brand new virus no one's ever heard of. So I wanted to be on the scene right where everything kind of started in the epicenter. And so I needed to go out there because really everything in Colorado had shut down and we didn't have cases yet. Just a little overwhelmed, thinking that I had no idea what to walk into in the next few hours, but here we go. It was probably the most surreal experience ever because I landed, you know, in New York City at the airport and there was literally not a soul. And so I spent a whole month out there working at a field hospital. So it's the first time in my career where I couldn't go back to a book, right? And say like, oh, what is this? Like, how do we treat this? How does, you know, what's the disease course? Like, we were literally living history.
I love you. Have a nice day. Hug.
The hardest part for me was, you know, watching my husband at home with my 2 kids, right? 3 and 5 years old. And, you know, it's hard to leave your family for that long. You do it because you know you have to, and you really want to be there to help other people, but... I didn't think I was going to get this emotional, sorry. You know, I think there's also just this, there's so much fear and anxiety. And, you know, there's the fear of like, hey, look, I'm going to go to the epicenter of all of this and put my life on the line, but there was more fear for me being at home and bringing it home to my family. And so, in some ways, it was actually easier for me to leave, and to leave them for a month, and then to leave them actually for the next almost year, because I knew I didn't want to get them sick. I don't want to say I came back broken, but being in the ICU and having to call families every day and say, here's your update on your family member, or wow, you know, they're going to die soon. Do you want to FaceTime with them? And then I was the person who was relaying their messages to them. You know, if you think about like how awful that is, right? Because some of the deaths that I experienced as one of the doctors, like the last person you see before you pass away, were just, it's a whole different type of loss. And I think for the family members, I think that's what made it really hard, was knowing that they couldn't be there. So I think that was the last of my travels, actually. I don't think I could do that. It's a very different way of having to say goodbye. I hit a point where I think it was the very end of December, I got my first vaccine shot, and I felt like everything just changed. And I was like, after I can go home. I will say when I first got my vaccine, I cried. Shocking, I know. You know, but it was just one of those things where it was just this emotional release, right? Of like, okay, maybe the world will be okay.
I'm keeping COVID-19. I'm keeping Steffi's COVID-19 shots.
My daughter did the cutest thing. She had a vaccine clinic for her stuffies that she would host every few weekends. And so I have these like amazing little videos of her like lining everybody up on our bed so she could give them the vaccine. This is before she could get hers. And so that's been my coping mechanism, is knowing that like through this all, like I have just an amazing group of family and friends that are gonna support me, even in my darkest times and in my best times. So I feel like many other people feel also, right? These last 2 years have felt like a time warp, right? They are so insanely slow, but then you look back and you're like, what have we just lived through? And I can say, based on, being in New York City in April of 2020 and knowing nothing about the patients that we were caring for and literally trying anything and everything under the sun, fast forward for 2 years later, and like, we have effective treatments, we have effective ways to prevent you from getting really sick. I hope that that brings people a little bit sense of security. So if somebody who's watching this video, I would want to say, number one would be like, please be kind to us. And remember, like, we're here to help you at the end of the day, no matter what. And then I think number two would be like, even though things seem dark at times, like, there is so much more to be hopeful for and to feel less anxious about and to be less scared of. So if you do get Omicron, what can you do? Well, first thing is open all your windows, because we know that COVID is a virus and the viral load actually matters. And I think that's the number one thing I try to keep getting across on social media is it's not over. We're going to have ups and downs, and we can predict them and we may not be able to predict them, but at the end of the day, at least your healthcare professionals have some idea of what they're doing. So hopefully that makes you feel better. Makes me feel better.